Assalamu alaikum guys, my dear fellows. I'm Dr. Mara and you are watching Dr. Health. This is my new channel. Please subscribe my new channel and don't forget to watch my videos. Today we discuss about the Ventolin inhaler and where we use, about its uses, its interactions, and where not to use and how to use, especially its dosage. Okay, let's start our video. Patients who have asthma, first line asthma, it's the treatment for first line asthma, bronchitis, bronchospasm, emphysema, exercise bronchospasm, and premature labor. We also use in premature labor. Mostly when we have some attack of asthma, then we can use this medicine. This is available in different dosage forms like inhaler, injection, solution, syrup, tablets, and so on. Mostly we see a tablet form and inhaler form. This is also beneficial in exercise bronchospasm. Like when you do some exercise or you do some workout or some activity, then you have some like spasm or you have some other asthma attack or something like this. So you can use this. And now let's discuss about its content direction. We don't use it with the asthma patients for asthma patients or with the arrhythmic medicines, hypertensive patients, and when we don't use this medicine in pregnancy. This is harmful for baby and mother as well. May cause some disturbance. If you have some problem, then you can discuss with your doctor or pharmacist. Okay, let's start about the differences. Like further, if you have some like if you don't have medicine available, then we can use its alternate like clenilzoltide salbo inhaler. These are also same salt, like this is the salbutamol, which is beta blocker agonist. That is the best medicine for asthma. Hope you like my video and also understand my video. Please subscribe my channel. Thank you. If you have a newborn baby and he have some asthma allergy symptoms or hypersensitivity, then you can use this medicine, this Ventolin inhaler, first line treatment. Mostly when you go for the patient of pneumonia, you visit the hospital, then doctors give them the first line therapy. This is my new channel, Dr. Health. You can subscribe, and if you want some more videos, don't you can comment me. Thank you. This medicine is very helpful and very effective therapeutic effect in especially upper RTI, lower RTI, all chest infections, and this is magical treatment for the asthma patients.